Health situation in Sri Lanka portrays a changing scenario. Morbidity and mortality trends and population structure are changing and non-communicable diseases are on increase. Thus, it's important to develop a comprehensive healthcare system to tackle the situation, which should be able to provide a continuous care, to deliver care services for disease prevention, early detection and rehabilitation, to have proper record-keeping system and which will be accountable for all activities initiated by it. State sector alone is not capable enough to provide good healthcare services. Several small studies showed that patients who follow the clinics at state hospitals were requested to carry out their investigations and purchase their medications from private pharmacy outlets. Studies showed that more than 60% of the patients get the primary care services from the medical centers which are owned by the private sector. Private healthcare business is a fast-growing industry in Sri Lanka. Allowing these practices would cause a lot of adverse effects on the health services. It's necessary to have alternative systems in place to meet the service gaps. Department of Community and Family Medicine, Faculty of Medicine, University of Jaffna would like to play a major role to revitalize the primary healthcare services with the support of national and provincial health services. Department of Community Medicine and Family Medicine is proposing a non-profit making, self-sustainable primary healthcare system in the whole of northern region with the support of various donor agencies. This system will be managed by the Primary Healthcare Trust through the primary healthcare centers which would be established in the rural areas. It is envisaged that there should be a primary care center for every 10,000 population. These centers will be able to provide treatment for minor ailments, physiotherapy, palliative care, advice on family planning and nutrition, and carry out health checkups and vaccination, and run a pharmacy, a laboratory, and a counseling service. These primary healthcare centers will be linked to the primary care center of excellence of the district, which could cater various needs of the primary healthcare centers, such as training facilities, telemedicine, CPD programs, e-learning facilities, virtual libraries, and graduate courses for healthcare workers. The primary medical care units of the Provincial Health Ministry would work hand in hand with the primary care centers. Further, the whole mechanism will be supervised by the Provincial Health Ministry and the Department of Community Medicine and Family Medicine of the University of Jaffna. The Department of Community Medicine and Family Medicine of the University of Jaffna will support the monitoring and supervision process. Further, the Department of Community Medicine and Family Medicine will be involved in trainings, running courses, developing guidelines, medical information control, and in research. The whole system would be supported from funds raised through patient contribution and from aid from international agencies, fee levied from training courses, individual donations, support from charities, aid from the foreign governments, and research grants. We should acknowledge the fact that these centers greatly differ from the private medical centers. First of all, these will not be profit-making centers, and there will be community participation at all the levels of care. Further, there will be a mechanism to provide financial concession to the patients whenever necessary, and more priority will be given to ensure the quality and patient-centered care. There will be also a mechanism to assess the cost effectiveness of the healthcare delivery. The state healthcare sector also will be benefited by this in many ways, such as the development of new health information system and reduced workload of the state hospitals.